Hello everyone, I'm Dr. Ian, the pediatric surgeon. This is good to be back on platform Dr. Says 360 to share with you some of my experiences in treating pediatric surgical conditions. Today I would like to share about the dangerous green vomit. Vomiting is a common problem in small babies and children. As we know, when they are unwell, they will vomit. Therefore, vomiting is not a very specific symptom, as the underlying causes are many. However, if your child vomitus is green, please do not take it very lightly, and this can bear serious consequences if urgent medical attention is not sought. This is a surgical emergency, and your child will need urgent surgery if the condition of malrotation with midgut volvulus is confirmed by radio imaging study. Let me share with you two of the cases that I have managed before. First, a term newborn male child delivered at 39 weeks and weighed 3.3 kg was referred after birth by the neonatologist for vomiting after 2 feedings. The second vomiters were noted to be bilious, that is simply mean green in color. Antenatally, a dilated stomach was noted by the obstetrician on the antenatal scan with no other abnormalities detected. Clinical examination of the abdomen of the child was unremarkable, with no abdominal distension. Abdominal X-ray done showed a dilated stomach with paucity of bowel gas shadows in the small and large intestines. An urgent upper gastrointestinal contrast study was requested and confirmed the diagnosis of malrotation with midgut volvulus with the demonstration of the position of the duodenal flexure, the so-called DJ flexure, on the right side of the spine and the presence of corkscrew sign. Surgery was advised and parents consented. He was operated on with the correction of the position of the intestines and relief of the obstruction without loss of bowel. He recovered well after surgery. Next, this is a 9-month-old female infant who was brought to the emergency department by parents after frequent vomiting over the last 2 days. The child was becoming more lethargic. Her antenatal period was eventful and she was an otherwise happily growing child until 2 days ago. Her last 2 vomiters were noted to be green and she started to pass blood in her poo. At examination, her abdomen was distended, erythematous and edematous with a palpable vague mass over the periumbilical region. Nasogastric tube inserted drained dark feculent materials, and per rectal examination showed fresh blood. An urgent ultrasound was requested and confirmed the diagnosis of malrotation with midgut volvulus with the demonstration of reversal of relationship of the superior mesenteric artery and superior mesenteric vein, the so-called SMA and SMV, and the presence of whirlpool sign. She was resuscitated before she was taken to the operation theatre. At operation, the diagnosis of malrotation with midgut volvulus was confirmed with extensive length of small intestine noticed to be gangrenous and required resection, with jejunectomy and distal colonic mucus fistula cited. This patient went through a very stormy recovery period with consequent short bowel syndrome, and she required the support of total parenteral nutrition, in short called TPN, with eventual introduction of enteral feeding with a very long adaptation period. The diagnosis of malrotation with midgut volvulus has to be considered as a priority diagnosis in a child presented with green vomit or bilious vomit, as this is a condition with dreaded complication if this is missed and not attended to urgently, as is illustrated by the second case. This condition can present as early as neonatal period and can present later in life as well. I have had the experience in treating and diagnosing this condition in an 8-year-old boy presented to me with vomiting, and after going through gastrointestinal contrast study, found malrotation and corrective surgery was performed. This condition is rarely seen in adults, but I do have a mother of one of my patients with Hirschsprung disease who was found to have malrotation after she was subjected to contrast study when she presented with abdominal pain and recurrent vomiting. She underwent operation for malrotation at the age of 30 years old, and I was lucky to be involved in her surgery as well. This happened about 16 years ago now. Surgery for malrotation can be performed in the open or by laparoscopy approach. Depends on the experience and training of the attending surgeon. I cannot overstress the benefits of laparoscopy, as this approach commonly leads to quicker recovery, early return of gut function with early commencement of enteral feeding, less use of stronger analgesia like morphine, especially if open surgery or laparotomy is performed. And lastly, you give a better cosmesis. The take-home message is, when your child does vomit out green bulk, do not take it lightly. There may be an incredible hug hidden behind it. Bring your child to the hospital, not to the general practitioner clinic, as additional investigations like ultrasound or contrast study ought to be performed to exclude the above dangerous condition. That's all for my sharing for today, and until we meet again next time on this platform, Dr. Says 360, bye bye for now.
If you like our channel, please like, share, and subscribe.